National World AIDS Day event at East New York Gotham Health Center. It's an event that we do for many, many years. We also included in the event like a Thanksgiving, just to give our members a place where they can enjoy, come and get hot food and just get some information and meet, the MetroPlus staff, the clinic staff, and have a good time instead of being in a clinical setting.
We're sharing a sense of community, also sharing experiences with our invited guest speakers, and also an enjoyable hot meal. So we're honored to be here with our MetroPlus Partnership and Care members.
Today we well serviced over 75 plus individuals in a small space, but everybody brought everybody together close like a family.
So World AIDS Day for me means equity. I am a nurse first, and of course that everyone is treated the same, no matter what diagnosis. It doesn't matter if it's HIV, AIDS, hypertension, cancer, equity across the board, and that we also treat people non-biased.
World AIDS Day means a lot to me because there's so many people who have passed, and then there's so many people who are still here and still living with the disease, and they're going on about their lives. They're living a positive life. It's HIV positive, but the positive means life to me.
Very nice also to share together the social service and social together and just relaxing.
I've been dealing with a lot of individuals, and I seen the sacrifices that they make, sacrifices that their body goes through when it comes to treatment. And World AIDS Day is a time of the year in the remembrance of everyone that is affected and has been affected and at risk. And I realized that this needs to be brought to the forefront.
World AIDS Day, and some of our patients are suffering from that. That does not define them. So we're happy that they're able to be here, be present, be healthy, taking their medications, asking questions, speaking to other patients that also are facing HIV as well. Just knowing that they have a village of support, that they're not in this on their own. We are thankful for our MetroPlus partners and ensuring that we can work with them day in and day out to get patients into our facilities, get them to see their doctors, get their medications on time, keep up with their regimens, and keep a healthy life.
Para mí me valoriza mucho, pero yo fue que a mí me dio una infección en los riñones y yo vine aquí. Entonces me bajó un doctor chino muy bueno. Entonces él me decía todos los días en la cama, quiero que te haga el HIV, no sé lo que él vería. Y yo renunciando, porque ¿cómo es posible? Yo no podía creer. Entonces al último yo le dije, sí, mándeme a hacer la prueba. Entonces él me la mandó a hacer y cuando volví para atrás, salí. Pero el doctor que me salvó mi vida a mí fue Jackson. Porque tengo hasta un retrato en casa.
Sí.
Yo llegué con 2.46 de tiza.
De tiza.
Eso era una cosa mortal.
Sí.
Él le dijo, yo se las voy a levantar. Él llamó a California por un medicamento. Me fue levantando, hasta que me levantó, que estoy aquí. Por eso lo quise tanto y lo quiero y le echo bendiciones. Ay, que Dios me lo bendiga.
Sí, yo lo sé que...
World AIDS Day to me is significantly important because I have been working in the field of HIV since the 1980s. And to see the progress that has been made in medical care and in the medication has been immense. But most importantly, what's really important to me as an employee at MetroPlus is to see the relationships that our members have made with their provider, and that's where the magic begins. Because by them having a good relationship with their provider, they have remained engaged in care. They have been able to engage and adhere to the medications that they're taking. They have good health care under one roof and build a very good relationship with their provider. And it is ultimately important for us to continue to advocate and teach our members what their rights are and to nurture that relationship that they have with their providers in order for them to stay in good health and have quality of life.
It's really to get the message out more than what we try and do every day, but to bring down the stigma and get people tested, people on PrEP, because we really should not have any more cases, but we do.
We're here not only to honor the 32 million lives lost, but also appreciate the 39 million people living with HIV worldwide today, whose strength and resilience really encourages us and pushes us forward in the fight to end the epidemic. This year's theme is Collective Action, Sustain and Accelerate HIV Progress, which speaks directly to the heart of what we all do here in Partnership and Care at Metro Plus. Together, we're not only connecting our members to life-saving care, but we're also creating a future that's free of stigma, discrimination, and HIV transmission. Our work is not without its challenges, but it is profoundly impactful. And I am continually inspired by all of your commitment and dedication to this work.
In 1979, my first cousin, Michael Waters, was diagnosed with HIV or AIDS at that time. He was in New York, could not get care because it was not available to people who were intravenous drug users and gay. So to see the progress that has been made with the medication insurance that's affordable for members would make him proud. So I'm thankful for this department for not only the affordable insurance, but the reinforcement that it gives me to say that we're making a difference. And oftentimes when I'm quiet, sometimes I think of him and what he would be thinking. So thank you.
I do my best because I reflect about times in my life when I needed somebody to listen to me and to take my issues seriously and not just pass it off. So I try to apply that to what I do, have that empathy. But also, like that, I had a brother, he passed away long in the 90s. He had AIDS-related illness, but he would always tell me about things he was experiencing, like neuropathy. And back then, there were few drugs at the time. The protease inhibitors weren't even around at the time. But I think about how much he would have benefited, living today. But also, like with people with HIV today, I see a lot of resilience in them, and it really inspires me, in a way that, I can live with resilience also.
So this member just came to the country from Thailand. He's scared. He doesn't know how he's gonna get his medication. And I remember doing an intake with him. He goes get his lab done right afterward, go see the doctor, and once his diagnosis was in, I was able to get him the medication for the 30 days. And got to the pharmacy, and I remember going up to him and I was like, all right, I got your medication. Here, walking to the pharmacy, picked it up. And as I was in the elevator with him to leave, like he's leaving, he's like, that's it. And he's crying. Like, he's like, thank you so much. I didn't realize, how easy it was and how much support I have, just come here in one day. And as he's crying, and I realized to myself, wow, we do our job every day, right? This is something that we do. We build rapport, we provide support, we provide resources, right? And we coordinate with providers, pharmacy, whatever resources out there that we need to speak to, right? But for him to cry in the elevator, just me and him, before he left, I realized that we are doing so much more for these members, more than we think that we are. We're just doing our job, but to them, we're providing so much support.
I think what's so interesting about World AIDS Day is thinking about what are the tools that are new to us and what are the tools that are the same for ending the epidemic. And there have been so many advances in HIV treatment since the beginning of the epidemic. Now 1 pill once a day, 1 injection every 2 months, and maybe in the future, once a year implant. But what has not changed at all is that it's always been about the interpersonal connections and the relationships that we all have with each other. and that this department especially really hones and uses that tool every single day. I know because I've heard y'all on the phone and know that now you're even doing work in person again with members. And that is as old as the hills and as important as ever.